It's not uncommon for dogs to lick their paws from time to time. Persistent licking of one or more paws indicates the presence of a problem. AnimalWised explains what these problems may be and whether the issue is physiological or psychological. My dog licks their paws compulsively. If your dog licks their paws non-stop, our first step is to carefully examine the area in which these licks are directed. This is most commonly the skin between their digits, especially on their front legs. Since their paws are in continuous contact with the ground when walking, it's possible they have been wounded by a thorn, broken glass, or similar sharp objects. Minor wounds need to be disinfected and their progress monitored. Check the info for a related video on why your dog's paws smell bad. If a foreign object is clearly visible in the dog's paw, we can remove it with tweezers and disinfect the area. If we don't succeed or the wound becomes serious, we need to go to a vet. There are other reasons why a dog licks their paws, something a vet will also be able to determine at a clinic. It's important problems are treated early, as not only can the wound become worse and complicated by secondary infections, but persistent licking can result in further injury. Other reasons a dog keeps licking their paws include atopic dermatitis. This is an allergic reaction that triggers an itching sensation in any affected area, including the paws. The dog licks both front and back legs, often causing the hairs to take on a reddish-brown hue. It can be difficult to control this allergy, as it's not always easy to identify the allergen that causes it, nor can we keep the dog away from everything that triggers the reaction. Treatment should focus on managing symptoms for which antihistamines, anti-inflammatories, and even immunotherapy may be used. PODODERMATITIS. This consists of inflammation of the interdigital area on both the back and front legs. It usually appears after trauma, a wound, contact with an irritant, allergies, parasites, systemic diseases, interdigital cysts, or psychological problems. The vet will have to identify the cause in order to establish the appropriate treatment. Interdigital cysts. More than simply cysts, these are inflammatory reactions that can be seen between the dog's toes. They look like a lump, and in some cases they break open and expel purulent content. They are usually caused by an injury, which can be a trauma, a foreign body, or a sting. Treatment consists of prolonged administration of antibiotics. Psychological causes. In some cases, compulsive licking is due to an underlying psychological problem. The dog licks their paws as a way to channel anxiety and stress it is experiencing. We must also take them to the vet in this case, as a physical problem must be ruled out before a psychological problem is diagnosed. In these cases, it's essential to modify the dog's living conditions and environment, something best aided by a veterinarian specialised in canine behaviour, a dog trainer, or an ethologist. Home remedies. It's essential to go to the vet for diagnosis, but we must follow the treatment guidelines closely. Any treatment we want to implement ourselves must be first agreed upon with a professional. Such supplementary treatments may include spending time with them and providing opportunities to burn off energy, stimulate them with activities both physical and intellectual, include essential fatty acids in their diet derived from fish oils to benefit skin regrowth, use moisturizing shampoos to keep their skin healthy, deworm regularly throughout the year, and check the legs after walks through wooded areas. More information on dogs and their care can be found in the playlist we share here. Tell us why your dog keeps licking their paws by leaving a comment below, and we'll see you next time.